Hello, hello. Well, it's me again. It's been a while since I last did a video. So this cancer journey is pretty much behind me. There's still little maintenance things when you go through it. In my previous videos, I talk about how I'm feeling, what the size of my tumor was, and all that stuff. So I'm not gonna get into it, but I will do a reminder of 2019 is when I found a tumor, and I end up finding out I had cancer. I had breast cancer on my right side. So about 2.5 weeks ago, I had reconstructive surgery. So I end up going the option of implants. I was gonna go with DEEP, DIEP originally, which is pretty much they take the fat out of your stomach and then they put it in your breast. But I decided not to go that route. Probably about 5-6 months prior to surgery, I decided not to go that route. I was pretty much tired of all the scars I was seeing on my body, and I didn't want to have another scar on my body, at least a large scar, because it was DEEP will be they'll cut you from here, pretty much from here to here. And I didn't want to go that route, so I just went with the implants. Even though I know that they do say about 10 to 15 years you will have to change out your implants. So that's the route I went. So hopefully my body do not reject the implants, because I do hear stories of people body rejecting the implants. So the implants are in both breasts. They cut me on my back, and they did remove a piece of muscle from my back and put in my right breast, which is where the cancer was at, which is the breast that received radiation. And because of the radiation and the damage of the skin, they decided to put a muscle in there before putting in the implant. So therefore there wouldn't be complications down the line or some type of an infection down the line. I also had fat grafting done, which they say is like liposuction. So they did fat grafting. I have 4 incisions. I have one on top of my belly button, one underneath my belly button, and on both of my sides, which are like my love handles area. Those were surprising enough, beside the big cut they did on my back, really painful. So I have those incisions, they're healing. I do have drainage tube for this procedure. Here are my drainage tubes. So they are attached to only on the right side of my body. When I had the bilateral mastectomy, I had drainage tube on both sides of my body, but this one's only on the right side. So I have 2 that's coming from my back, and then of course drainage tube that is connected to my front. I do keep a log of the flow of the liquid goo, I like to say, that's coming out of my body. This is pretty much my log chart. So every morning, every night, I write down how many fluid am I dumping out. This is the cup that helps me. I use to help figure it out. So pretty much I take a drainage out, well, not out, but out of the pocket that I have. This is the pocket I use for when I'm taking a shower. But since I'm wearing black and green, I decided to rock this. There's a cloth one that I use just wearing around the house. But pretty much take the tube out, dump the fluid in, and then there's little, you can't really see on the camera, but there's little numbers on the side, and then I measure it that way. And that lets me know, like I said, I do it in the morning and I do it at night, and I put a total for the day, and that lets me know if it's flowing right. It lets me know if in my next follow-up appointment they'll be able to take it out, or if there's a possibility they'll leave it in. So according to my doctor office, they say that if it's under 20, then there's a possibility they will take the drainage tube out. And of course above 20 they'll leave it in, because that's pretty much letting them know that my body still have a lot of fluid to take out. So the surgery was on June 8th. I had to stay one night over the hospital. I think the surgery took about 2 hours, 2.5 hours, which my doctor says usually it takes a little bit longer, not because of what he's doing, but because he's trying to figure out what implants work for my body. So my understanding, there was 3 different implants. There were the size of which my expanders were at, and there will be a size below and a size above. So during surgery, my surgeon will put in the different implants and figure out which one aligns right with my body. I don't know which one he ended up choosing. I don't know that yet. I don't know if they look bigger, so I don't know if it's the same size of my expander or if it's bigger. They look bigger. They did say I'm a little bit swollen, but pretty much the size I have will be my natural size. So, but prior to the surgery, I did need to get the green light from my cardiologist, the green light from my radiation doctor, and from my oncologist to move forward with surgery. During surgery, they did remove my port, so that is out. I now see my cardiologist. I saw my cardiologist, I think last month or 2 months ago. My echo looks good. My heart's looking good. Everything is, you know, back to pretty much where it was prior to being diagnosed with cancer, or I should say prior to getting chemo, which was the AC, the red devil, that made a bigger impact on my heart. So, but everything's looking good. So now I'm seeing my cardiologist a year out, and then I'll have another echo done, and from there we'll decide, well, the doctor will decide if I need to continue seeing her or I'm done with the cardiologist. The radiation doctor, I saw him. He is good with how I am healing from radiation or how my skin looks. He's concerned about the color of the radiated breast is not yet where it needs to be regarding the color of my non-radiated breast, but he is telling me just to continue using shea butter, keep that area moisturized, so therefore the color could come back. So I don't have to see that doctor because he was pretty much good. Otherwise than the coloration, he was good with how my breast is healing from radiation. I don't see him till a year out. And then at that time, next year, he will decide if, like he said, I graduated for radiation or if I will have to continue seeing him. But I think there's a possibility it'll probably be the last time I end up seeing my radiation doctor and my cardiologist next year as far as follow-ups are concerned. My oncologist, I still see my oncologist. The thing is, I think once you're diagnosed, you're supposed to see your oncologist for 5 years. So far I'm seeing my oncologist every 3 months. Yeah, every 3 months I believe I'm seeing my oncologist. So I'm due for another visit. I think it's next month or 2 months from now. 2 months from now, I think, to see my oncologist and have them talk to me. I don't know what else they're gonna do for me. I guess they're gonna do blood work since my port is gone, so they're gonna probably go the traditional way of getting blood work from me. And I guess they're just gonna keep checking my blood. Last time I was there, they told me everything looked good, my blood looked good. So they didn't have any concerns. I am feeling great. I am pretty much almost back to my old self. So this cancer craziness journey scare is pretty much behind me. It's crazy how it was just last year I was battling this, and then now I'm like able to do stuff and do things and just enjoy life the way I used to without the restrictions or without the side effects and the getting tired so easily. So I think that's pretty much it that I have to share regarding my reconstruction surgery. I would show you the cut on my back, but I have on a sports bra, and the sports bra kind of cover it. And since I'm still healing and recovering, there's certain, I don't have full mobility, so I won't be able to turn around and pull down the sports bra. No, I'm still in pain. I'm still in pain. I have wean off of my pain meds, and I have a high tolerance for pain, so I wean off my pain meds and just try to deal with the pain myself. But I'm not fully mobile where I could just move my arm and do certain things. Like I said, it was 2.5 weeks ago that I had surgery, so my mobility is not fully there, and how far I can reach or stretch, it's not really there, especially when I have tubes coming from my side, so that also caused limitation. I am practicing with makeup. I believe I was practicing with makeup last year during this cancer journey, so I think I'm slowly improving. Now I have this fascination for lashes. My lashes grow back in. Didn't bother with fake lashes while I was going through chemo and all the other stuff when all my lashes fell off. Now I have a fascination for lashes. So what I have on is magnetic lashes. I have the other lashes, the fake lashes that you use eyelash glue for, but practice make perfect, and I'm not skilled at that yet. I'm still practicing. So I heard magnetic lashes are easier to put on. So this is the magnetic lashes I'm using. It came with 2 magnet glues, and of course this little device to help me put it on, but I have not used this device. So far it does make it easier. It takes less time for me to put the lashes in, so you can see that I have nice lashes. I think for the most part they look natural. I don't know, until somebody be like, oh wow, you have on fake lashes. But so far I'm loving the magnetic lashes. The only thing I don't like is really hard to take the glue off once I take the lashes. So I'm still struggling with that and finding a product that works best for taking the glue out. I had my hair done probably about 5 days ago. My sister-in-law was nice enough to do my hair because I did not have my hair done for surgery, because they have you take a bath with a special type of solution. So something like this, when you're going in for surgery, where you have to wash your whole body, your face, private areas. You do not wash with the solution. So I had to use that solution. Actually, you may not need to put it on your face. I don't remember, or maybe you do. But anywho, so that's the solution I used prior to going in for surgery. So it was the night before surgery, I had to take a bath with that solution, and the morning of surgery, I had to take a bath with that solution, and then I had to wash my hair. So the old braids I had in, I had to take it out, wash my hair, and then it just went into surgery natural. And then I needed something done to my hair and feel beautiful again after getting chopped up, sliced, and all types of stuff. So my sister-in-law ended up doing my hair. So she came over last weekend with my brother. My brother ended up doing yard work at my place for me while I continue to recover. So if there's anything else that happens during this journey, or as I'm going through this process with follow-up appointments with my doctor, I will post a video and share. But pretty much this is me, and I look at old videos and there is a big difference, and I am loving it. I am loving the space I'm in. I'm loving where I'm at. I am loving that I'm putting this all behind me. I am loving that I can actually do a video and not sound like I'm out of breath, because the other videos I checked out, I'm like, wow, I really sound out of breath. And it's not like I was running a marathon prior to doing the video, but when you go into treatment, it does take a lot out of you. And sometimes you don't realize at that moment the amount of energy it takes out of you. But thank you, as always. Thank you so much for listening. Thank you so much for watching. Hopefully you learned something from the video. I wish everyone a great day. Peace, love, harmony. Until the next time, take care. And if you are battling cancer, I will be praying for you, because any cancer is just whew, it's a battle, regardless of what stage you are in, regardless of what cancer you're battling. It does take a toll on you emotionally, physically, and I'm praying for you, and I'm rooting for you, and I'm wishing you the best. Rosemary, once upon a time, was diagnosed with stage 3 triple negative breast cancer. Take care. Much love.